Guys, welcome to DOCSHAALA. In this series of NEET MDS 2022 recall series, we are going to see a video on Mesiodens. So an IBQ question, that is an image based question, was asked in the previous exam based on Mesiodens. So let's see what that question involves and what is Mesiodens. So this is Dr. Janvi here. So let's just begin with the topic now. So as you can see the image here, so this was the image that they have given in the exam. Okay, so what is seen in the given image was the question, and the options given were peridens, mesiodens, distodens, and supernumerary tooth. So as you all know that the answer is mesiodens, of course. So why is it called as mesiodens? So you might have a question that it can also be called as supernumerary tooth, but why only Mesiodens? So let's just look why it is like that. So a Mesiodens is a supernumerary tooth that is present in the midline between two central incisors. So Mesiodens is also a supernumerary tooth, but when it is present in between the midline of two central incisors, it is called as Mesiodens. So it actually results in the oral problems such as malocclusion, food impaction, and poor aesthetics and cyst formation. Okay, Mesiodens may occur in single, multiple, unilateral, or bilateral. Okay, then the presence of multiple supernumerary tooth like supernumerary mesiodens are known as mesiodentes. Okay, so this is an important term, just keep this in mind. So etiology indicates that there is a genetic susceptibility together with environmental factors, so that might increase the activity of the dental lamina, which leads to formation of extra tooth or teeth. Okay, genetically or some environmental factors may lead to the formation of mesiodens. Okay, so the complications which are involved in this mesiodens are: there is delayed eruption of the incisors. Okay, then there is crowding, there is spacing, sometimes there is impaction of permanent incisors, there is abnormal root formation of the incisors, alteration in the path of eruption of permanent incisors may be seen. So diastema may be seen, cystic lesions, intraoral infection, rotation of the incisors, root resorption of adjacent teeth, or even eruption of incisors into the nasal cavity was also observed. Okay, so let's just look at the treatment. So immediate removal of Mesiodens is usually indicated in the following situations. So we have to have certain situations where we have to remove that Mesiodens tooth to protect the remaining teeth, right? So this is when there is inhibition or delay in the eruption of permanent incisors, then there is displacement of adjacent teeth, when there is interference with the orthodontic appliance if the patient is undergoing any orthodontic treatment, when there is presence of a pathologic condition or spontaneous eruption of supernumerary teeth. Okay, so there are two methods of extraction for Mesiodens, that is early extraction, that is before root formation of the permanent incisors, and then there is late extraction, that is after root formation of permanent incisors. So you can extract the Mesiodens with these two methods. One thing, before the root formation of permanent incisors. Second thing, after the root formation of permanent incisors. Okay, then if at all the patient is not exhibiting any symptoms, it could be left untreated along with regular checkup. Okay, but regular checkup is important. Okay, then so these are a few images showing the Mesiodens. Okay, so this is the Mesiodens here in this image, and this OPG, you can see that the Mesiodens is making the eruption into the nasal cavity. So here also, so it is going upward like this. So in this image, you can see an incisor being erupted into the nose. Okay, so this is how it is surgically removed, right? So this is an OPG. So in this OPG, you can observe Mesiodens here, right? So from the image, you can see that it is erupting in between two central incisors. Okay, so this is a primary one. So this is central incisor 1 and 2. So it is erupting in between these two. So hence it is It is a Mesiodens. Okay. If you like our video, do like, share and subscribe to our YouTube channel. You can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also follow us on our Telegram. Thank you.